Hello everyone, I'm Nelly Ziade, Associate Professor of Rheumatology from Beirut, Lebanon, reporting for Room Now from the EULAR Congress in Barcelona. Now I will talk to you about emerging therapies in axial spondyloarthritis. I want to tackle three treatments that were discussed at the Congress. First one is xeliegekumab, an anti-interleukin 17 inhibitor, A inhibitor. The second one is ivarmacitinib, a JAK1 inhibitor. And the third one is not an old one, is not a new one, it's an old one, but with a new delivery mechanism, it's colchicine. So let's start with the new one, with the first one. It's always difficult to pronounce the name. This is OP0102. It's xeliegekumab in radiographic axial spondyloarthritis, efficacy and safety. This is a phase 3 trial. So this is a fully human monoclonal antibody that selectively neutralizes interleukin 17A. This was a 48-week phase 3 multicenter study conducted in China, comprising a 16-week core treatment period, then a 16-week maintenance period, and a 16-week follow-up period. The eligible patients were randomly assigned to receive Xeli 100, Xeli 200, or placebo. At week 16, the patients receiving placebo were then re-randomized to receive either Xeli 100 or 200. What was the primary endpoint? It was a proportion of patients achieving an SS20 response at week 16. So they included 465 patients. At week 16, there was a significant higher proportion of patients in the treated group, 200 and 100, achieving SS20 remission compared to placebo. So 74% in the 200 milligram, 65% in the 100 milligram, and 36% in the placebo group. The efficacy was sustained through week 48 in the Xeli treatment group. They also saw a significant reduction in disease activity as measured by ASDAS, ESR, and CRP. Also improvement in physical function and spinal mobility, with the 200 dose showing slightly better benefits. Concerning adverse events, there was no really surprises, 1.6% of SAEs, no unexpected safety concerns. So we hope that this is, again, a new option for treating our patients with axial spondyloarthritis. The second poster is POS 0757. It's about ivarmacitinib in patients with active ankylosing spondylitis. This is a post hoc analysis that stratifies the initial results by baseline characteristic of a phase 2, phase 3 trial. So what is ivarmacitinib? It is a selective Janus kinase 1 inhibitor and has shown already efficacy in patients with active AS. And this time they are trying to see if it stays active, significantly efficient in patients across different categories. So 186 received placebo, 187 received ivarmacitinib, and they showed a significant improvement in SS20 in all subgroups. So what did they study? Age, less than 40, more than 40, male or females, BMI below 24 and more than 24, people with a disease duration less than 5 years or more than 5 years, with and without history of biologic or JAK inhibitor, with a VAS score of back pain less than 60 and more than 60. So across all categories, the treatment was effective, but mostly in patients who were young, so less than 40, with a lower BMI, with SS duration of less than 5 years, and without a history of biological or JAK inhibitor treatment. So no real surprises. Again, another option for our patients. And the last treatment, as I said, it's not a new treatment, it's an old treatment. It's colchicine, our old friend. It's POS 0013, and what they did is they did intra-articular slow-release treatment with microspheres containing colchicine in an inflammatory arthritis rat model. So this is a novel intra-articular combination, sustained release colchicine and ropivacaine an anesthetic in a rat model of acute inflammatory arthritis. So they encapsulated colchicine with microspheres of biodegradable PLGA polymer to enable sustained release. They combined it with the anesthetic ropivacaine. They adapted a model of intra-articular carrageenan-induced arthritis in knees or ankles in the mice. They induced the arthritis, and in the following 1 minute, they injected either the colchicine or other also parallel group, including dexamethasone, for example. So after injection of the CAR, all animals developed an inflammation. And they found, for example, that dexamethasone exerted a significant effect on pain, inflammation, and joint destruction, but also colchicine was effective for all these 3 parameters, so pain relief, inflammation, or destruction. And the concentration in blood over 72 hours after injection remained at very low levels and significantly below toxic thresholds. So what hope does this study give us? So we know that colchicine is a very effective drug. However, we are several times you are limited by the dose that we can deliver because of the toxicity. So this could be a very good option for treating acute inflammatory arthritis, since so to limit all the toxicity of oral colchicine. And with that, I would like to thank you for listening and to follow Room Now for more coverage from EULAR 2025 in Barcelona.